and welcome. You're listening live to Heart-to-Heart, a program which aims to help you understand and to become your loving self. This is KMET 1490 AM, ABC Radio Live, and I'm Dr. Mitra Rashidian. I'm a licensed marriage and family therapist and a certified sexologist in full-time private practice located in beautiful Encino, California. And this afternoon, I have Dr. Robert Jaffe, my best friend, colleague, and business partner, whom also he's a licensed marriage and family therapist, and I'm introducing him in a set of him. He's patiently listening to me. And, we are going to be talking about codependency, addictions, trauma impacting our relationships. Dr. Robert Jaffe.
Yes, so welcome everyone. And today we're going to be talking about the healing process. What are we healing from? We're healing from any traumas that we have experienced in our lives. We used to think about trauma as only being what we would call large T traumas. A large T trauma could be like any natural disaster, like floods, or hurricanes, or earthquakes, or it can be some imposition of one person taking over another person's rights, such as robbery, such as burglary, such as physical assault, such as sexual assault. And so these are all traumas. And what makes it a trauma is that the person feels powerless, enraged over what's going on, and powerless to do anything about it. And it impacts their sense of self and their sense of safety in the world. So these are what we call the large T traumas. Now, recently, and I'm going to say recently in terms of psychology over the past 50 years, we have expanded our definition into what we would call small T traumas. And small T traumas can go as small as slights to the person. Let's say insulting remarks.
Right.
You say something insulting to the person. Or it can go to the place of emotional abuse, where you berate the person and you call them names. These are also assaults on the person, but they're not as well known or well defined as the large T traumas, but they can be just as dangerous to the person's sense of self and also impacting the person's belief about how effective they are and how safe they are in the world. That then affects all of their relationships.
And I would like to add that, some of the small T traumas that they stay pervasive across life that happens within families is when parents they start to compare their children with each other.
Right.
They start to compare them with the neighbor child or the cousin or the best friend that they have. And then they impose on them what they should be or what they shouldn't be. And also, every time there's an achievement, it goes unacknowledged. And the concept of, nothing is good enough and you need to do better. And so these are some of the examples of small T traumas because the child, becomes confused about his or her sense of identity. That's one aspect of it. And then also with each trauma, the child develops a form of defense about how to protect themselves.
Right.
And then these are the pervasive parts that they continue to use those defense and those sense of identity across their lifespan. And also they keep adding on based on that foundation. So once there is a shaky foundation and then, pervasive hurt and anger and trauma, imagine how that develops in adulthood and ultimately in relationship.
Right. So
I mean, I kind of went way fast forward, but
yeah. So when we're traumatized, and all of us have had some traumas, it doesn't mean that we carry the memory of that trauma with us until the day we die, and we're affected by it until the day we die. It depends on how we responded to it in the moment. And then later on, if there are symptoms that are telling us to look in that direction, how to resolve it. Because traumas can be resolved where they're no longer affecting us, certainly to the degree that they would be affecting us, and we can heal from those traumas. And if we don't heal from those traumas, then those traumas come out through our behaviors, our belief systems, our attitude, and affect us and all our relationships.
Yes.
Yes. So once we are traumatized, if the trauma is overwhelming to us, and that depends upon, number one, what the trauma is, number two, the age that the trauma happened to us, and number three, how we responded to it. So what happened to one person may not be traumatizing to another person.
Exactly. And then the key point here that I like that you said is how we respond to a small t trauma, right?
Right.
The way we respond to a small t trauma comes after how we do it, our own interpretation to the trauma.
Correct.
Right.
Correct.
So first the traumatized person or the child or anybody who receives an small t trauma, they need to internalize it, process it for themselves, make meanings about it. And then obviously one of the reasons that we respond back is in the way that we do is because we lose the sense of safety. Trauma takes away sense of safety, right? So whether that's a large T trauma or a small T trauma, it impacts our sense of safety, and also it impacts our self-trust.
Right.
Right. So I just want you to look at the speed of these translations, right? When a trauma happens, and then let's see how a trauma happens and the child responds back. But within that U shape of going in, the introjection of the trauma, right, and the process of that, and make meaning of it, and then for the child to respond to that is a spirit of a second.
Yes.
Right?
Yes.
But then that meaning making stays in our subconscious and becomes a lifelong, form of responding to a given situation.
Right. Right. And so what we're talking about is how does trauma affect us as we go through life? And the answer is if the trauma was so traumatizing whenever it happened, whether it was at age 6 months, whether it was at age 2, 5, 12, 20, whatever that happened, if it was overwhelming to us, and we felt powerless, and we felt enraged, and we felt humiliated or shamed, all of those feelings, how we responded to it at that time will determine whether we carry it with us and whether it is still problematic in our life. And so the way we respond to things that we observe, or things that are said or done to us, is how we respond is our response ability.
Right.
So taking responsibility means accepting that how you respond to something affects the impact of that on you, and how you impact others. So what we want for others is for them to take responsibility for how they respond to things, and we need to do the same thing, to take responsibility for how we respond to things. Those things can be things that are imposed upon us from the outside. Those things can also be things that we are carrying inside of us from the past. And it's our responsibility to learn how to respond to those things in a way that does not damage ourselves or damage others.
Exactly.
Yeah.
Yes. And that's something when we open up the word responsibility, divide it and make it actually the original format, which is responsibility.
Right.
Yeah. this ability is something that we need to learn. We need to become skillful at it.
Right.
It's not something that we are born with it. It's not an instinct. It's not a natural phenomenon.
Right.
Okay. It's
Right.
something that we learn within our family of origin.
Yes.
Right.
Yes.
It's just starting from the very basics as an infant, how to communicate when you're hungry, right? Or how you communicate when you're on a sleep, right?
Mm-hmm.
What kind of a crying tone to use,
Mm-hmm.
right? And then feeding, and how to learn to hold on to your, to the bottle, or how to pick up the spoon later on and eat, and how to use a knife. So as we see, everything is a learned process, that they are external of us. Right. So then how to respond to situations is also a skill. So we are able to learn. Right. So it's not that we cannot say is response inability, or even though that's the word that is used, but we want to learn the ability. We want to learn how to respond to pleasant or unpleasant situations.
Correct.
Right. And
Correct.
this is a skill that we need to learn when we grow up.
Our abilities are developed.
Are developed.
Yes.
Exactly.
Yes.
Right.
And so how are our abilities developed? They're developed through teaching and through modeling.
Modeling, yes.
Right.
Right.
So how does this relate to codependency? How does this relate to addictions? And how does this relate to relationships? So going through childhood into adolescence, into adulthood, there are developmental tasks that we have to learn how to do in order to move on successfully to the next level of development. And those developmental tasks, if they aren't developed when we're supposed to learn them, either in childhood, adolescence, or young adulthood, middle age, or older adulthood, those tasks stay left undone inside of us and cause problems in the way that we deal with our emotions and problems in the way that we deal with other people.
Right.
So what happens usually in addictions and in codependency is that these developmental tasks have not been fully learned at the time that they were supposed to have been learned. And so the person in teenagehood or in young adulthood or middle-aged adulthood still responds as though they were 2 or 3 or 5 years old, because developmentally in that particular arena, they haven't matured enough.
Right.
And so a lot of what we're dealing with in life is people who haven't matured through these developmental tasks because they had poor modeling and not enough instruction on how to deal with their feelings and how to deal with other people related to their feelings.
So is that correct to say that they developed in kind of an inability how to respond to situations, versus developing their ability how to respond to situations?
They develop. They have an ability to respond, but that ability is limited.
Yeah.
because they haven't been helped to understand.
Right.
So a perfect example of this is with my 2 granddaughters. So I have 2 little granddaughters. They're twins.
And they're so adorable. Oh my God! You should see them.
I just love them, and they're wonderful. They're going to be 3 in June, and so of course, as developing infants and now toddlers, they learn about toys and they play with toys, and one is playing with the toy, and when one is playing with that toy, the other one, at times, not always, wants the toy that the first one is playing with. So what will she do? She'll go over and grab the toy. And then the one that she grabbed the toy with will cry, right? So what is the developmental task? The developmental task is twofold. It's one, to use your words, because they can speak now, and they speak in complete sentences. You start talking at around age 2. They're now going on 3. They can speak. So one is to use their words. That's a developmental task. And the second one is to share, right? Those are 2 developmental tasks that they need to learn how to do. So what happens when one goes over and takes the toy of the other, and the second one is crying now? My daughter, who has a master's degree in childhood education, and has practiced psychology, and has made it her job, along with her husband, to raise emotionally healthy kids, will walk over to the one who took the toy, and like my two granddaughters are Sophie and Vivian. So if Vivian took the toy from Sophie, she'll walk over to Vivian and she'll say, "Honey, Sophie was playing with that toy. And if you want to play with that toy, that's okay, but you have to ask Sophie if you can have a turn." And so since you didn't ask her, I'm going to give this toy back to Sophie. And if you want to play with it, you can go ask Sophie, right? So she'll take the toy, and Vivian will then get upset. And then she'll say to Vivian, "You're upset because I took the toy away, but the toy wasn't yours to begin with. The toy was Sophie's toy. Now you have a choice. You can play with these other toys, and there are 10 million of them, or you can walk over to Sophie and ask her if you can play with that toy." Now, it gets more involved, of course, but those are the developmental tasks,
yes, exactly.
right? And so
Basically
basically,
communicate about what you want and what you want to do,
exactly,
right?
exactly.
In a healthy way.
Yes, yes. And so they're at a rudimentary level learning how to speak up for themselves, how to ask for what they want. And then if they don't get it, then my daughter helps them understand what they're feeling. You're upset because you really want that toy. And even though there's a lot of other toys around, you want the one that she's playing with right now.
And incidentally, all the kids are like that.
And they're
Most of
all
the
like
kids, they
that.
just want that one toy.
They want the one
The
because
other one,
because the other one's got it.
right. Let's talk more about this fascinating topic right after our commercial break.
Okay, we will see you soon.
See you soon.
Afternoon, beginning at 3 p.m. Join us.
Welcome back from our commercial break. This is Heart-to-Heart program at KMET 1490 AM ABC News Radio Live. Dr. Robert and Dr. Mitra here, offering you a program on codependency, addictions, trauma, and relationships. And we are talking today on the aspect of how we develop our codependent behavior, right?
Indeed.
And then we would like to hear from you. Do you have any experience similar like this? Do you know of somebody who you believe, based on our conversation, may be having a codependent, approach into their life? So please tell us. We want to hear from you. Our phone number is 951-922-3532. And if you are interested in our prior program, please go to the archive sections of KMET program. And also you can visit us on our YouTube at heart-2-heart.online/YouTube. And the microphone belongs to Dr. Robert Jaffe.
Great, thank you.
You're welcome.
So we were just talking about my 2 granddaughters,
yes.
And we were talking about developmental tasks, and that a lot of people miss going through important developmental phases in their life. So what we were talking about was my 2 little almost 3-year-old granddaughters, 2 twin girls, and how one will take the toy of the other, and then how my daughter will give both the children, words on how to express what they're feeling and what they're wanting. So if one takes the toy from the other child, the child who got the toy stolen can say, "Please give me the toy back. I was playing with it," and then they can discuss it between themselves. But they can't do that if they don't have the words for it. So my daughter gives them the words, and then they experiment with the words. Now, of course, they're very young, and things don't go smoothly, right? So, but it doesn't matter because what she's doing is she's teaching them that there are ways of dealing with it both internally. You know, you're upset because, and then she'll tell them why they're upset. Sometimes she knows that they may be hungry, and they will start, you know, getting fidgety or starting to act out rambunctiously. And then she'll say to him, honey, maybe you are hungry. And if you're hungry, then your body is going to want to, it is not going to want to do what you want it to do. So maybe you can tell me if you're hungry. Are you hungry? And if the child doesn't know if they're hungry, because that's a learning process too, then my daughter will say, well, would you like some carrots, or would you like some strawberries, or would you like some yogurt? And she'll make offers to them. And then if they keep saying no, then you say, well, maybe you're not hungry, and
Maybe
that's
you're
okay too.
tired.
Maybe you're
Sleepy.
tired, you know. And eventually, because the parent is observing the child and knows what the child may be experiencing, and then gives the child words to understand it, eventually the child learns how to identify what's going on inside of them. So then they can say what's ever going on inside of them, whether it's something physical or something emotional.
And I have witnessed that myself up close and personal with your daughter and how she communicates, with your grandkids and also her husband. And I have to say that they're doing this in such a patient and loving and calm way,
Mm-hmm.
right? So that the child feels like that they are invited to learn the process.
Yes.
The child feels, so safe to stop what they're doing and actually listen to their mother.
Mm-hmm.
It is as though, wow, something's happening here, and I'm open to learn about that.
Right.
That's the sense that I have gotten from that interaction every time I have seen it.
Mm.
I mean, the fact that your daughter is so patiently and calmly and lovingly, does this teaching to both of her daughters. I think that's a very good example for other mothers who are having, infants, or they are looking for guidance as to how they can do this for their own kid. So the key words here are calmness, patience, and loving.
Right. And you and I, we end every one of our programs with all you need is love.
All you need is love.
And actually, that's not far from the truth. And the Beatles were right when they said it. Um, but the question, of course, is what if you didn't get that? See,
Right.
what if you didn't get that as a child? What if your parents were less than loving? Or what if your parents were loving at times but weren't loving at other times? Or what if your parents were very rarely loving or never loving and were just very strict and authoritarian and even abusive?
Mm-hmm.
See? And so that's when we're talking about trauma, because then you have been traumatized because you haven't gotten the love that you both needed and deserved.
And I'd like to say something here about the small T traumas. And when I have shared this concept with my clients that they have been traumatized, they say, but isn't that, all the kids grow up that way?
Mm-hmm.
And they say they never looked at their experience as a traumatic event, right? But so how do we come up with the concept of a small T trauma is actually through neuroscience,
Mm-hmm.
right?
Right.
Neuroscience, an aspect of neuroscience talks about a small T trauma and suggests that how we behave in adulthood, we are the product of our environment and the culture that we grow up in, right?
Right.
So then the culture is, a part of culture is the norm of society. The environment could be a combination of the geographical area and what's available in that geographical area, along with the culture, and how the culture is transferred from one generation to the next generation, along with the meaning making and the meaning transferation and the intergenerational concepts that, how these information are passed to the next generation. So we see that, sometimes those type of interaction becomes so normal. It becomes so, uh, you know, engraved in even in our brain cell, that we don't think of them as abnormal. We don't think of them as traumatic, concepts of life. And that's when the kids come and the adult says, well, my brother was raised like that, my cousin was raised like that, my siblings were raised like that, we turned out okay.
Yeah, exactly,
you
exactly.
know
And so when I hear that, and you've done a good job in explaining that,
Thank you.
yes, and then and then so people say, well, this is the way everybody was raised, or this is the way everybody was raised in my community, and we turned out okay. I say to them, and yes, you did turn out okay, but that doesn't mean that you turned out uh, okay with respect to how you deal with your emotions, or how you make, or how you deal with your spouse, right?
Right.
It may be that things are tolerable, and it may be that even there's not a big problem in the family,
Or it
but
seems that way. I mean, we're so used to discomfort that we are comfortable with the familiar uncomfortable situation.
right, right, right. But let's really
Right.
take a look at what's going on inside of you, as to how comfortable you are, as to how safe you feel, and as to the messages that you're giving to your spouse and to your children. And so if they're open to looking about that, and that's probably the biggest word in the English language, even though it's only two letters, which is if you're open to looking at that, and we really can't grow unless we are open to looking at the truth of what's going on inside of us, we will find that there are a lot of things that are problematic for us that we didn't recognize before. And that's what the process of psychotherapy is about. It's about helping the person understand things that they didn't think about before, because those things have been hidden in our subconscious. So, what we're talking about today is codependence and addictions. And codependence is probably the largest form of addiction and the most unrecognized form of addiction.
And so pervasive.
And the most pervasive, yeah, the largest, most pervasive and
Right.
unrecognized. And so, how do I identify a codependence as an addiction? And codependence is an addiction to things that are outside of us to make us happy. So the more we're looking for the thing to make us happy, the trip to Disneyland, the new diamond ring, the bigger house, the new car, as long as we look to those things to make us happy, we miss out on the feeling of connection and love that is inside of us, that we can share with other human beings. And so this brings us back to the idea of our ego and our spirit. And our ego is about feeling safe physically. And if we are raised in any sense with um, large T traumas or small T traumas, internally we have not felt safe physically, and that prevents us from moving into the spiritual aspect where we feel love, because all of our energy is devoted into feeling safe. And that's where we end up with addictions, because what addictions do is they give us a feeling inside of feeling temporarily better.
Right.
But the question we have to ask ourselves is, why do we need to feel better? Nobody asks that question. But the reason we need to feel better is because we're carrying things inside of us that don't feel good, but they're beyond our ability to name them or identify them. So, so since we can't name them or identify them, we just continue to be the way we are, assuming that this is the way it's going to be forever, and assuming that everybody feels the way that we do.
Right.
We can't feel happy unless our ego is in the process of getting something.
And an example of that is a couple that I have right now,
Mm-hmm.
right? So the husband has, addictive behavior.
Mm-hmm.
And so since they came to therapy, he was able to put aside that addictive behavior.
Mm-hmm.
And then I got a call, from the wife that she got information that apparently his addictive behavior are returning.
Mm-hmm.
And she was like furious. She was so alarmed. I said, "Oh my God." And I said, and you and I talked about this,
Mm-hmm.
and I told her that so the behavior is not okay. However, we want to understand what contributes for the behavior to come back. What are the
Mm-hmm.
internal state of mind that causes all of that?
Right.
And many of that are subconscious
Mm-hmm.
and even unconscious, where
Mm-hmm.
we can even access,
Right.
right? And then she says she can see that, but for the meanwhile, she was so frightened. And I said, you know what? Her fear is not gonna, it's understandable, but not helpful.
Mm-hmm.
Instead, she just needs to be calm and, if she wants to make a comment on the behavior, which is not appropriate, she can. And then she can also bring it up here on our sessions, which
Mm-hmm.
she agreed to do that,
Mm-hmm.
right? Because we want to know the motives, internal motives, subconscious motives.
Right.
Right. And without that, all these behaviors, even if they are under control consciously, eventually they give themselves in, so it just the behavior comes back.
Right. Right. We in our society, for the most part, think of willpower as the ultimate. That if you have strong enough willpower, you can change your behavior about anything.
Exactly.
And what we have learned as therapists, and we have probably 60 years of combined therapist experience between us, what we have learned is that willpower will change the person's behavior, but that it won't last.
Right.
That the person can't keep it up, because if it stops with, if it ends with willpower, whatever is going on subconsciously, whatever uncomfortable feelings there are, keep coming up. And because the person isn't aware of it, it eventually wears down the willpower and it comes back. And it may not come back in the same form, it may come back in a different form. For example, a lot of people who are alcoholics and have learned to go to Alcoholics Anonymous or gotten therapy and stop their drinking, often pick up cigarettes, right? And they become much more. Or they turn to food, which is even more common. Mm-hmm. And they use food in an addictive way, because when you eat food, you change your physiology and and your brain releases feel-good chemicals. And so you feel better temporarily. But of course, it wears off. So the thing with all addictions is that it makes us feel better temporarily, it wears off, and then we have to keep doing it.
Right.
So what I say about addictions, and this includes codependence, is that it makes us feel better temporarily, so it gives us relief, because yes, we get that feeling of we don't have to worry, we're taken care of. We have that feeling that both relationships, food, and drugs give us, that we're safe and everything is good, but it doesn't give us release from those feelings, so they keep coming back.
So let's talk more about PM. Join us. Welcome welcome back from our commercial break. Dr. Mitra and Dr. Robert here at Heart to Heart program at KMET 1490 AM ABC News Radio. Dr. Robert Jaffe is sharing his thoughts and practical and clinical expertise about codependency, addictions, trauma, and impact relationships.
Right. So we've been talking about codependence as being the most common and also the most hidden of all the addictions. And codependence basically is about us not completing, starting or entering or completing developmental tasks that we needed to do as children. So that's where it begins. And we don't learn how to identify our feelings, our emotions. We don't learn where our emotions originate. We don't learn how to communicate our emotions. And we depend on things outside of us, just as we depended on our parents who were outside of us to make us feel better when we fell down and skinned our knee.
Right.
They would make us feel better if they were loving parents. They would first soothe us emotionally. It's okay, honey. You got a skinned knee. It hurts right now. It's going to get all better. I'm going to help you with it. So you're calm. You're reassuring. You're telling the child that it's okay. And then you say, okay, now, and we don't tell them to stop crying. We say, yeah, it hurts, and that's why you're crying. And it's okay to cry when you're hurt, and also you can know that when you get hurt, when part of your body gets hurt, it's gonna, when it gets injured, it's gonna hurt, and then you might cry, and that's okay. And then you know what? The hurt will start feeling a little better, and then the tears will go away too. So let's you and I, now fix up your knee. We'll go get some Band-Aid, and we'll get some things to make it clean, and we'll fix it up, and the boo-boo will start to go away. Now that's an example of how to comfort somebody who's hurt their skin and knee. In a way, it's also symbolic of how to comfort someone when they're emotionally hurt. So you talk to them about their hurt, you allow them to have their feelings about their hurt, and then you reassure them that you care about them, that you're there to hear it, that you're there to listen, and if you can help them in some way by giving them some advice or by helping them understand, things from a different viewpoint, then you help them heal that wound, that emotional wound.
Exactly.
So that's what's supposed to happen in childhood. When it doesn't happen, we don't learn how to do that for ourselves, and we don't learn how to do that for our partners, and we also don't learn how to do that for our children.
So it's a responsibility again.
It's the ability to respond in a healthy way to what's going on. What is unhealthy? Unhealthy means hurtful. It's very simple. What's healthy is loving. What's unhealthy is hurtful.
Yes.
So we don't want to hurt people when we care about them.
There are people that they don't really recognize that they are hurting people or they are hurting themselves. They just know that, some things is uncomfortable and they respond to the discomfort.
A lot of people. That's what we're talking about here. Yeah. Because when we don't understand that we are hurting ourselves, we continue to hurt ourselves. Now, what we said before was the subconscious runs the show, right? So often I will ask my clients, do you have self-talk? Do you talk to yourself in your mind? Sometimes the person says no. It's just a feeling that I have. And then when they say that, I say, okay, if the feeling could talk, what would it say?
Mm-hmm.
But a lot of times the person says, yes, I hear myself telling myself I'm such an idiot, or I should have known better, or what's wrong with me? And then I say, okay, would you say that to a friend? Somebody that you like, would you say that to a friend? And often they'll say no. And I say, why not? And then they will stop, and then they will say, well, it's not a nice thing to say.
Mm-hmm.
I said, so why is it a nice thing to say to yourself? And so that's that. But what we do again is we learn from, as children, we learn from observing people around us, starting with our siblings and our parents. We observe them. We copy our parents since they're the ones who are big and strong and know everything, quote unquote, because we're little and we don't. So we look up to them to teach us, and they teach us by either instructing us or through their own behavior.
And that's why we say, probably that's why we say, well, everybody grows up that way, so it's okay,
Right,
you know,
right.
because we were not told, or we were not taught differently. So everybody else grow up that way, and they all survived. And you're right. I mean, they survive, but
Mm-hmm.
emotionally, no, they don't survive.
Right,
Physically we may survive, but not emotionally.
right, right.
You know.
So, and so, what does that mean when we say emotionally we don't survive? What that means is that the part of us that is loving, the part of us that's caring, and the part of us that wants to be felt for who we really are goes underground.
Exactly. Yes.
And what surfaces in its place is what we would call our false self or our codependent self.
Absolutely.
So the codependent self says, I am who you think of me as being. So I need to make sure that you have a high opinion of me. And that means that if you don't have a high opinion of me, that I have to then eliminate you from my life or change your mind. And so that's the essence of codependency. So if it's people that are married and have decided to stay married, eliminating them from their life is not the option that they choose. So what they do is they try to convince the other person that they're wrong about their perceptions and about what they're seeing.
And that reminded me of some examples of how I see that within couples. For example, I have couples where they come in and they say, the husband says, well, my wife, decides for me what to wear.
Mm-hmm. Mm-hmm.
Right? She buys, all of my outfit. When I want to go to a party, she puts my jacket and my everything on the bed, lay down for me. And I just do that. I just follow that. And then, but then again, there is a sense of unhappiness there,
Mm-hmm.
right?
Right.
And then when we process that, we see that ultimately, they feel being controlled. They
Mm-hmm.
feel being like they're not good enough for who they are, and the wife is actually trying to change them
Right. Right.
into something that she feels safe with.
Yeah. Yeah.
Yeah.
And we're using this as an example. We talked
Right.
before about metaphors. It may be that the husband feels perfectly fine with allowing her to select his
Right.
wardrobe, but that may be, and that particular thing may not be an issue in their relationship. But if there's a vying for control, then that vying for control will come up in some other way.
In some other ways, yes. I mean, it's not so this behavior, this control, this wanting to change, it's not just happening in that. So if it happens in one area, it definitely, it shows itself in other area of the relationship,
Mm-hmm.
right? So it's not just limited in, to selecting the outfit for your spouse. It goes in other parts, that how do you end up controlling each other
Right.
in other areas of life,
Yes.
right?
Exactly.
And when I say an example, it probably is not a pleasant example, but they say if you see one what is one roaches, right? One roaches
One
in
roach.
one roach, then you probably have 1,000 of them
Yeah.
hidden.
Yeah. Yeah. Exactly. Exactly.
So it's
Yeah.
something like that,
Yeah. Yeah. So we've talked about codependency today. I'm gonna end because we only have a few minutes left by talking about stages of recovery. which are enumerated in this wonderful book that came out in the 90s by Charles Whitfield called Codependence, Healing the Human Condition by Charles Whitfield. Um, and he enumerates 6 stages of recovery from codependence. And I would say these are, because codependence is an addiction, these are the same 6 stages that people need to go through in order to heal their addictions from the inside out. Now, I'm not saying that psychotherapy is the only way of doing this. Psychotherapy can facilitate that if the therapist is familiar with addictions and knows how to work with people. But also, the 12 steps has their own program in terms of helping the person work through things. And it can be very effective. And the good thing about the 12 steps, like Alcoholics Anonymous or Narcotics Anonymous or Codependence Anonymous, the good thing about that is, number one, it's free. And number two, you get a sponsor, somebody who's worked those steps and helps you through it. So a combination of the 2, therapy and the 12 steps, I think would be the most efficacious. But here are the things that need to be done. And then next time we will go a little more in depth in talking about what those steps are. But the first one is grieving. Grieving means that if things happened to you in the past and you had abuse issues and you had parents who were not that loving or less than loving, or you had a lot of confusion in your childhood, you've had losses. The loss was that you didn't have someone there who understood you and helped you to understand yourself and your feelings. Those losses need to be grieved. The second part is what we call original pain work, which means that we talked before about having the small trauma and the large trauma. So whatever traumas you've experienced needs to be understood and resolved inside of you so that you're not carrying the pain of that trauma around with you. We call that original pain work. The third is working through core issues. What would be a core issue? A core issue would be, like for me, a core issue was I have to take care of other people's feelings. That was a core issue for me. Still is a core issue, but I'm getting better at it. So that means that I can't state my truth if I think I'm going to be hurting somebody. So that's a core issue, and so we'll talk more about that. The next part is doing personality work. How does my core issue manifest in my life? How does that affect my personality and the way that I relate to people, and the way that I connect with people or don't connect with people? That's personality work. The next one is completing developmental tasks, and we talked about that earlier, like being able to name your emotions, understanding what you're feeling, understanding how to share, like we talked about with my granddaughters. So those are examples of developmental tasks. And the last one is setting healthy boundaries. So setting healthy boundaries means that just because you're close to someone doesn't mean that you get to run them, right? So you were talking before about controlling a controlling wife, could be a controlling husband. And so we have to be able to say, honey, this is my affair. This is not your affair. I run this part of my life. You don't get to tell me what time to get up in the morning. You don't get to tell me, that, things about myself that are within my purview. And that's true for both of you. So those are the things we will go into later in our next session.
And I'm looking forward to it. And I think, the more we know about these concepts, the more we are going to be helping our listeners and our viewers. So at this time, our program is about to end. And I'd like to invite you to please join us next week at 3 p.m. for another episode of Human Sexuality, and at 4, continuation of codependency, addictions, trauma impacting relationships. And until then, don't forget, all you need is love.
All you need is love.
Love, love, love.
Love yourself.
Bye-bye.
Bye-bye.